everybody. This is Chris.
And Kathy.
We wanted to take a minute to thank you all for tuning in. We appreciate every listener and are grateful for this platform.
Please help us share our vision by subscribing to our show through your favorite streaming app. Follow us on Facebook, Instagram, TikTok, and YouTube at Petability Podcast.
Check out our ever-growing list of affiliates and sponsors. Simply go to the show notes for information and links.
And be sure to use our promo code PETPOD22, that's PETPOD22, on checkout to receive your discount from our affiliates. And now, here's a word from our sponsor.
Hi, I'm Alon Landa, CEO of MedcoVet, and I'm a proud sponsor of Petability. We decided to partner with Chris and Kathy because, like them, we want to empower all pet owners who are trying to do the most for their pets. At MedcoVet, we specialize in advanced home laser therapy for pets. Laser therapy is a safe and effective treatment for common conditions like arthritis and wounds, and it relieves pain for most conditions caused by inflammation. With MedcoVet, pet owners can perform this treatment at home while receiving support from experienced clinicians. If you think your pet would benefit from healing at home, visit medcovet.com, and one of our clinical experts will work with you to determine if home laser therapy is the right fit for you and your pet. Tell them Petability sent you.
What I want to see is that dog is able to now get up off the ground, able to go outside independently, to go to the bathroom, able to take a walk or a hike with their owners.
Welcome to Petability. I'm your host, Kathy Simons, certified veterinary technician, certified canine rehabilitation practitioner, and certified hospice and palliative care technician for pets.
And I'm your host, Chris Cranston, licensed physical therapist and small animal physical rehabilitationist.
Our podcast provides interviews and information to help your pets live their best lives.
Hello, Kathy.
Hello, Chris. How are you doing there?
I'm doing great. You know, I can't believe, well, I can, because we both like to talk so much. And so does our returning guest, I think, I dare say. But we are having Carrie Adrian back to finish talking about custom bracing. You know, when is an orthosis appropriate? Because we ran out of time.
I know. Well, it's an important topic, and I think that it was important to have a two-part series on this, and we rarely have a two-part series. So there's just so much information to cover.
Tis true. Yeah. So much information, and we thought we could get it all in from, nose to tail, so to speak. But we decided we didn't want to cut any content out. It's also valuable. And that, we didn't want to have to rush. So we divided it into two parts, as we've said. And part one actually published on July 14th, 2026. So tune into that. That covers the front end and some of the trunk stuff. So that is great. And then today we are going to be getting a little bit further into, I should say not a little bit further, but taking a deep dive into the hind end orthoses and what works and what doesn't. So, and Kathy, should we share that we actually saw each other's faces yesterday?
Oh my gosh, we saw each other face to face yesterday. Also, how cute is your mom? Your mom is so cute. She's so cute.
Yeah. Did a little road trip down south to the southern part of Massachusetts. So Kathy lives about an hour and a half away, and we happened to be in the neighborhood. So I texted you and said, "Are you up for a visitor?" Because I hadn't seen your new digs and hadn't seen your pug Mac in a long time. So that was awesome to.
Oh, he was so happy to see you guys. So sweet. Such a good man.
And we took a picture to prove it. So maybe we should.
Yeah. I'm going to post
that
it
on our socials
so people can see that we actually exist and that we know each other.
This is what we look like now.
Yeah.
All right. Well, so for all you listeners out there, welcome back to Petability Podcast as we continue our conversation with Dr. Caroline Adrian, canine physical therapist, a leader in our profession of small animal physical rehabilitation, and founder of Canine IQ in 2021, an educational platform for physical therapists to earn competency treating canine patients. Carrie, as she kindly allows us to call her, earned her PhD in canine biomechanics, which makes her the perfect guest for this two-part series discussing canine orthoses. Her view and expert opinions are not associated with any company, so she can provide guiding principles with a no BS examination of what works and what doesn't. When considering an orthosis is appropriate and when one should not waste their time or money. Drawing on years of clinical experience and expertise in biomechanics, custom fabrication, and rehabilitation, Carrie is a trusted resource in the rapidly evolving field of veterinary orthotics. Her passion is helping patients regain function while educating veterinary teams on the science behind proper brace selection, fit, and long-term success. In part one, Carrie introduced us to the fundamentals of canine orthoses, explored options for the forelimbs and trunk, and explained how properly designed devices can restore function, improve comfort, and enhance quality of life. In this episode, we pick up where we left off with an even deeper dive into hind limb orthoses. So welcome back for the third time, Dr. Adrian.
Thank you, ladies. Truly happy to be here.
We are truly happy to have you back, Carrie. I learned so much from the last discussion that we had. We even talked a little bit off air about one of my patients, and maybe we could talk a little bit about that as the podcast goes on as well. And making a decision between which bracing, which orthosis, which support is appropriate for patients. So yeah, let's talk a little bit about that. But let's begin with a quick review of the thoracic and trunk orthoses.
I think for the thoracic limb, we primarily focused on shoulder and carpal hyperextension injuries, with shoulder mostly with instability related to medial shoulder instability, using more of a soft brace, if you will, such as dog legs hobble, to limit that AB or adduction, that splaying motion, and to allow healing. And really the focus with hobbles, I know there's a lot of controversy out there, focus with hobbles being primarily that there is a professional involved to monitor that. Because when you think about the shoulder being held onto the body wall by muscle only, dogs do not have a clavicle or a collarbone. So all of that is muscular. And if you limit mobility for an extended period of time, you're going to reduce that mobility. So very important to maintain a relationship at least once a week if your dog is wearing the hobbles. With elbows, we have used some products out there, but most of the time it's a custom orthotic related to unloading or relieving that weight-bearing stress related to osteoarthritis. And it's few and far between, but it's out there. We just need more information on that. Carpal hyperextension is probably the biggest that we use an orthotic device for. And we've had some really, really good success with unilateral or bilateral, meaning both limbs, and applying an orthosis on both forelimbs to stabilize that carpal hyperextension.
Yeah, when it comes to the shoulder, again, I think it's just really important to say we're limiting the motion through the use of the hobble type device, but if not supervised and used appropriately, you could actually decrease motion that is desired long term. So that's what we're trying to prevent, because they obviously need to have appropriate motion. We're just allowing healing and limiting inappropriate motion, and one plane in particular. So yeah, a lot of potential out there for elbows. Hopefully things will be coming down the pike for that. And yeah, I don't think anybody should hesitate to splint or brace or use an orthotic on a carpal hyperextension injury. Very, very successful.
For sure.
So let's pivot to the trunk supports that we went over. There were two products that you mentioned there, Carrie.
Yeah, so for trunk stabilization, for proprioceptive input, for pain reduction related to osteoarthritis, we showed some videos of the wiggleless back brace versus the hip line for trunk stabilization, pelvic stabilization, as well as pain reduction. So I think there's some confusion out there which patient would benefit the most from either of those braces. And I want to say that there's probably not one specific example that I would say if your patient has, XYZ, you have to go with Wiggleless versus the hip line. Everything depends in veterinary and canine physical therapy. And are there concomitant issues related to that pathology? If it's pure hip OA, that hip line garment will help improve posture of that patient. So we see gluteal atrophy. We sometimes see rounding or kyphosis of the thoracolumbar spine, where they're tucking their rear because they're trying to avoid hip extension, which is painful in dogs with hip dysplasia. What these hip line garments do is to improve that posture. They provide sensory input. They correct the posture. They allow for more activation of the core musculature to carry that dog through a less painful gait and improve mobility. Versus that Wiggleless back brace, I tend to use for more severe trunk instability related to neurologic disease. And a lot of what we have tested these garments with or tested the Wiggleless back brace with is dogs with degenerative myelopathy, some of the dogs with lumbosacral issues, some dogs with thoracolumbar disc disease. But again, especially in neuro patients, these garments can become overstimulating, especially in diseases that progress like DM. It can become too much as that patient continues to lose function. It can become overbearing to a point where now you're getting no mobility. So extremely important to understand the dog's history, any concomitant issues. Oftentimes orthopedic disease looks like neurologic and vice versa. Is it truly just hip osteoarthritis, or is there some weakness through degenerative spinal disease, especially in our older patients, versus true degenerative myelopathy, or is it something disc related? So all of these have a big asterisk next to them, which is why it's so important to work with a veterinary rehab professional or canine physical therapist to help identify which brace is the most appropriate. And that may change, gang. That could change with time. That could change in several months. It could change, in a few weeks even, depending on the progression of the disease.
So glad you said that, Carrie, because I have so many senior patients, right, who maybe don't have a definitive diagnosis, right, because maybe the client has decided that they don't want to put their dog through the diagnostic process of determining whether they have DM or lumbosacral disc disease. But it's also the change, right? So these dogs are going to change over time. So whether they have a progressive neurologic disease or maybe they have hip OA, there will be some changes over time. And maybe you start with one, right? And maybe you change to the other. Would you say that might be true?
For sure. Absolutely. Absolutely. And a lot of these dogs, are born with hip dysplasia. And those hip line garments can be excellent, for posture, maintaining muscle mass and muscles that, as I mentioned, the gluteals, so as that hip OA progresses over time, those muscles will atrophy. Well, if I use the hip line garment, and this is something we still need to study, but super interested in understanding, let's do a study, ladies, right? Let's look at these dogs who are not so many questions. But that's the beauty of this field is, can we correct the posture early to maintain muscle mass of those gluteals and reduce the decreased hip extension, maintaining that mobility for a longer period of time. But as that patient gets older, so now that Labrador with hip dysplasia is 10, 12, 14 years old and has degenerative disc issues, becoming a little more neurologic and perhaps requires more trunk stability, where we could introduce a back brace of some sort, the Wiggleless.
I'm also thinking, you're talking about the gluteals. Those muscles, primarily extend the hip joint. And we're talking about gait and mobility, but I'm also thinking as dogs age, so many, a vast majority get weak in the rear end. So if we can maintain the gluteal strength, then rising from the floor can be so much easier because they have that muscle mass and that strength to do that. So, one functional activity affects another. And if we can maintain, function and muscle mass and mobility in certain activities, it will impact positively other functional daily activities as well.
For sure. And that's the independence, so the dog has to get off the floor before it can walk.
Right.
So I feel like, our profession sometimes focuses too much on gait analysis. Well, how about transitions? And how about the sit to stand?
Mm-hmm.
So yeah, all kinds of things that we could look at.
Carrie, let's make a point of that. These garments, as you call them, or braces, the dogs can transition into various postures, right? So it's not something that can just be used for when they're up and about, but they can sit in it, they can lie in it, they're comfortable, they're mobile.
Absolutely. And again, it's important to note that as, in these progressive diseases, it may become too much to a point where they can no longer do that. But once they're up, it provides that stability for gait and for mobility.
Let me ask you this, Carrie. You've mentioned a couple of times that as these dogs that have conditions like degenerative myelopathy, as they progress, then the garment may not be appropriate for them because it was overwhelming. Can you explain exactly what that means to our audience?
And maybe overwhelming is not the right word. It's overstimulating. When you are losing muscle because of progressive joint disease, degenerative myelopathy is not a disease of strength. So you can't say that I'm going to put your dog with DM in an underwater treadmill and we're going to strengthen, because there's a disconnect of nerve to muscle. So that atrophy is not part of it's disuse, but it's a neurogenic atrophy, meaning there's no longer a connection from the nerve to muscle that causes activation of that muscle. So now we're putting on this trunk garment, and as that dog continues to lose that muscle activity, now it just becomes almost a little
burdensome, right?
more of a burden, for sure. So now we just don't have that muscle activity to fire to allow us to move anymore. So now, and we're dampening it even more by putting on this device that's causing more restriction.
Thank you, Carrie. Thanks for clearing that up. I was very interested in what was the overstimulating process. If you think about things like thunder shirts or anxiety wraps, you're using them sometimes just to calm those sensory receptors, right? So I was like, well, how do we overwhelm those sensory receptors? How is that an overwhelming experience? But I can see what you're saying. It becomes burdensome as the disease progresses.
That's correct. Yes.
Kathy, you read my mind when you went into the thundershirt concept, because something that's wrapping in a diffuse manner actually inhibits muscle firing to a certain degree, right? And it's calming. So
it's more inhibitory over time. Yeah.
So there's a time and a place.
Yeah. And if a cat's getting an injection, what do? You tap it on the forehead, and you provide that sensory stimulus to overwhelm those pain fibers that causes that inhibitory effect. And it's very, very, very similar.
It's fascinating, Carrie. It's fascinating.
It is. It really is.
So, Carrie, before we take that deep dive into the hind limb orthoses, let's talk a little bit about, why quality matters in these devices. And there are so many options online now that are just screaming at pet parents. And with all these products out there, then that leads to just more and more questions, I think, not only for those pet parents, but for us veterinary professionals as well. And so why is not a copycat or knockoff or non-custom brace, orthoses, whatever you want to call it, maybe the best way to go? Are they ever appropriate?
Yeah, talk about overwhelming, right? People will sell you anything, and if you don't do your homework, then it could actually be more detrimental than good. And, I've seen some knee braces, some stifle braces for cruciate rupture that go, around the limb, up and over, around the dog's neck. Well, that kind of thing could be proprioceptive, right? We talked a little bit about sensory. There is some level of sensory input. But if you think about, and we'll get into this in more detail with stifle orthoses, it's not a sensory issue. Especially in a dog that has angulation. You have true instability when you lose a cruciate ligament. Same with medial patellar or lateral patellar ligament issues. Just putting in orthoses or a soft brace over the knee does nothing for the mechanical aspect of instability. And don't let anybody tell you otherwise. It's pure sensory. So if you're looking to reduce drawer, if you're looking to reduce patellar luxation, none of those soft splints are going to do that.
If you're looking to truly stabilize, that's the bottom line.
That's the goal.
And you're trying to control millimeters of movement that are
correct.
Deep in the body.
Correct. And even with our high temperature thermoplastics, we have some preliminary data, but it's not 100%, sagittal flexion limitation in sagittal flexion. And with the canine stifle, you can't control all 6 planes. That's a really complex joint, is a dog knee. And it moves in all 6 planes. It's front, back, side, rotation, right, rotation, left. So with any type of external device, even with the high temperature, your primary motion is sagittal. So that's your flexion and extension as it swings front to back with gait. That's what we're trying to oppose with a canine orthosis. So that is why I have always done custom orthotics in these dogs, especially with the stifle braces or the stifle orthoses, because it's extremely important to understand what is it that you're trying to control. What's the biomechanical design of that orthotic device? And it needs to be a good fit, or we're going to cause a lot of breakdown. And it's actually going to be more detrimental than good for the patient, for the animal.
If clients would just ask us, we know there are certain companies that we've been working with for decades. So just reach out to us. Yeah.
Yes. And I can tell you that Hero Braces, I have worked with exclusively for over probably 25 plus years. I don't even remember anymore. But there's a reason. The biomechanics to me is what's the most important. And we can talk about, we can go into as much biomechanics as you guys want. But we all might need a glass of wine for that. But it's really interesting to see, do you control the paw or don't you control the paw, and why? So all things we can talk about.
Well, I think one of the more obvious things, as there's just this explosion of inexpensive, quote unquote braces online. And, some are soft, some are hard. They're made of plastics or metals. And, I think there are a number of risks for these cheaper knockoffs. Oftentimes I think that we are trying to, save some money, but in the end, you're probably going to end up spending more, because maybe doing nothing is better than applying an ill-fitting brace to a body part that it's not helping, because then you end up with veterinary care.
Well said.
Yeah, I think the number one thing is the skin injuries, pressure sores from rubbing, and then causing issues in joints above and below. Maybe the opposite leg as they're compensating, or, from maybe it doesn't fit well. They're not comfortable. So they're subtly offloading and even shifting to the opposite forelimb, and then causing a shoulder issue. We've seen a lot of studies supporting those kinds of things, and, maybe even causing not an overt injury, but delayed healing instead of speeding it up, or muscle atrophy from that subtle disuse of that limb that you're putting something on that feels weird, right? So dogs are very crafty at shifting their weight off a leg and us not being able to appreciate that. But over time, again, I think there's where you see not just the wounds and such, which are obvious, but the muscle atrophy, the shrinking, from disuse and not fighting gravity, not using that leg and function as much.
Yeah, so, and the breakdown, and for sure the breakdown.
The skin breakdown is a big problem.
And I don't want to, blow smoke. We certainly have. There are potentials for, for breakdown in an orthosis period, and that's why it's super important. Number one, to go custom in my mind, because the fit is exactly what it needs to be. And there's certain issues that can happen over time, like the Velcro gets furry and it wears out, and the orthosis begins to slip, for example. So that sort of thing it can certainly happen even in our custom braces, which is why it's really important to have a professional monitoring, the patient. But there's definitely, if owners go and buy something off the shelf and they don't understand what and why they're purchasing it for, that's where we get into a lot of trouble.
I think you have to keep in mind too, if you're buying something, off the shelf, that dogs don't just come in small, medium, and large. There are different body types, from the endomorphic breed types to the chondrodystrophic type dogs, and how their bodies are, how different is the Corgi body from the Greyhound body, right? It's completely different. They don't just come in small, medium, and large. So buying an over-the-counter for your dog, it could be problematic because they may not fall into that category, small, medium, and large, right?
Right.
So yeah. If I had a knee brace, I don't think I would pass it off to Chris and say, okay, this should fit you, because
all assistive devices, right? Especially canine carts. I see a lot of people trying to share doggy wheelchairs, and it has to be fit correctly. Exactly. It's the same for orthoses, for sure. Right. Yeah.
So, we were talking about skin breakdown, and Carrie, I think you mentioned in part 1 that you have a case with a dog that suffered some pretty severe integument issues.
Integumentary, yeah.
For our listeners, go to Petability Podcast on YouTube so that you can view this video.
This is one of the worst cases that I've seen. The dog had IMPA, immune-mediated polyarthritis, and you can see that it's down in all 4 limbs for the most part, and it even has some, thoracic limb issues. But obviously, the worst is in the rear, and you can see the hyperextension here in the carpi as well. But majority of that came from the pelvic limbs, and this is an old case of mine that I showcase a lot. As a pretty severe example, but notice how she's low in the rear. She's super flexed in her pelvic limbs, which most likely over time, we're going to see some back issues here. She's super flexed in her knee and her hocks. And even after a while, she's like, you saw her walk, maybe 5-10 seconds max. She's ready to sit down.
She is struggling. That is hard to watch, Carrie.
It is hard to watch.
Hard to watch. You can see the distress on her face as well. She's just putting
panting.
So much energy. Yeah, she's exerting so much energy to take those 5 steps.
You got it. And this is Cammie with the off-the-shelf braces that she came to me in, and this is even harder to watch in my mind. And notice, again, the panting, the stress. She is not comfortable. You can tell this is doing nothing. Yeah. This is doing nothing, absolutely nothing to support those pelvic limbs.
Oh, poor
this
girl.
To me is even more difficult to watch. But this is why we have the sores. It's not an appropriate fit. It's not an appropriate style for what she needs. And this is why biomechanics, like it or not, gang, biomechanics are important, and understanding biomechanics of why we are, why we use the orthoses that we use to support and stabilize. So this is Cammie when we put her in an appropriate style of brace. I show this video all the time because watch her reaction. Her response is, there's her little sibling.
And look at the change in her face already. Like even the change in her face is different right away.
But what's funny, she sits down immediately.
She is not
used to wearing and walking in a more normal fashion. And look, she does. She's like, get these off of my
Walking
leg.
Bronco.
She's like, what the heck is
You
going
talk
on?
about proprioception, you talk about all of that, but the design of these braces are totally different. And this is her 5 minutes later in a more appropriate brace for her. And now she's up and moving. You still see that instability. She's learning. She's learning how to walk again, right? In a more normal, upright fashion. And we made some tweaks after this, but getting her into the proper orthotic to put her in a more normal anatomical position was priority.
Going to be life-changing for her. Let me ask you this. She hasn't been up and using her limbs in the normal fashion for probably quite some time. Do we have to address after we get her in the proper position? Are you addressing like her upper body's probably like, whoa, we haven't used our body in this way in a long time. So I imagine there must be some compensatory related stuff that we may need to address as well, given that we changed that posture.
100%. And what she's doing is shifting forward. So not just posture in the rear, all of these changes, and look at the low head carriage. So what ends up happening is when they shift that weight forward, their head drops. And so in order to see in front of them, they're doing more cervical spine extension. And we start to see breakdown here. We see breakdown in the shoulders. I mentioned the carpal her wrists are starting to break down, most likely, certainly due to disease, but also most likely because of that weight shift forward and putting more stress up here. So what happens is it's a short, choppy stride in the front, and we start to lose scapular mobility. And we start to see all of that taken up through the whole thoracolumbar spine. 100%. Right. It's tough.
Just think about how different this dog's life is now, right? Can you imagine the difference in her life now that she has the mobility, the stability, and the confidence really to move? It's going to change. It's going to change everything about her life. She can meet you at the door. She can go for a walk. Maybe she can play with the other dog. It's going to be completely different for completely different.
26 years later, this is why we still do what we do.
Yeah. This was great. This video is worth 1,000 words, as I say. Videos, I should say. The series. Wow, just so eye-opening. Let's pivot if we can and get to the stars of the show today and really focus on the hind limb orthoses that we all tuned in for.
Took us a while to get there.
I just get so excited.
I know. I love it too. Okay. Rein us in, Kathy. Rein us in.
You got just a bunch of nerds talking about orthoses. Don't mind us.
Love it.
Well, I'd like to start with just again touching on the hip line. So we mentioned it in the context of trunk support and pelvic support or hip dysplasia causing, hip arthritis. So let's just touch on that a little bit before we get into the stars of the show, which is the stifle and tarsus.
You betcha. Yeah. So a lot of that hip line is, again, we talked about proprioceptive sensory input and activating the correct muscles, which maintains that gluteal muscle primarily, with OA. We're looking to correct the posture. It's dynamic stabilization. And what does that mean, right? What is dynamic stabilization? You think about dynamic, and that's movement, right? So we want to be able to maintain proper alignment when we move. We talk about, with improper alignment, with improper dynamics, things can start to break down. So in dogs that are more flexed in their knee and their hock because they don't want to extend their hips due to pain, and now over time, if we walk in a crouch position, we start to lose that mobility into hip extension. The joint capsule gets tight. The fascial tissues surrounding that region get tight. So now we want to control the joint during movement. We want that neuromuscular control to keep the appropriate muscles firing that help to stabilize the joint. So if you think about, and maybe this is too deep, but if you think about, with hip flexion, your most efficient motion with a muscle is mid-range. Once you get to end range, either more flexion or more extension, those muscles are not firing as efficiently. So if we are trying to avoid extension, now we are reducing the efficiency of that muscle. We're changing the control of the nerve to muscle activation. And we start to see the changes in those passive tissues. So if we can control that joint during movement using some sort of a dynamic stability garment, such as hip line, now we're able to improve mobility and ultimately decrease pain in that patient.
So what do pet parents report to you with use of this garment, this hip line? What do they see first?
Excitement, to move. It really, it's night and day, and they're like, wow, I can actually move more comfortably. And it's almost, I haven't touched a human in 26 plus years, but you really see, they talk about people with back pain and they're almost afraid to move because it hurts. And once you put these garments on, it provides that support to allow them to move more comfortably. And the animal's like, oh, you know what? I can move and it's okay. And that's what I equated to people with back pain that move, they're initially intimidated or uncomfortable because they're worried about the pain. And I believe dogs do the same.
Yeah, I can imagine. And just, I think a lot of times people just report, increased playfulness, increased energy. It's almost like imperceptible, but not, it's not like, when they go on their walks, maybe it's not as dramatic as they'd hope, but overall they can just tell, right? It's mom's intuition, if you will. And just like we saw with Cammie getting in the right device, I mean, her whole demeanor changed. You could see her face lit up. So I get that.
And it may take time, right? It takes a lot of time and effort to move wrong, and to fix that also takes time and effort. And keeping that in mind, it may not be overnight. It may not be within 5 minutes, but over time, the appropriate muscles are going to start to fire again, and things are going to start to move more correctly, if you will.
One of the things I get for feedback for clients when we've done something that to be supportive of whatever, the trunk or the limb or whatever, and then they report that the dog is doing something it hasn't done in a long time, getting in the chair, getting in the car. But the thing they get the most excited about is my dog started stretching again. They're like, you're not going to believe this. I didn't realize my dog wasn't doing her own stretching. And today she got up and she stretched and she laid down and she stretched. And I'm like, yeah, feels good.
Yeah, I forgot. Yes, that's a great one as well. And same with fun. We start to see them shake more and more comfortable shaking. Yes. Love it.
Okay, here we go.
The number one most common orthopedic injury in a dog. I think we probably all know that, and we probably all know at least one dog of our own that has ruptured a cruciate ligament. I think one of the first things we should touch upon is, what do you do about a cruciate ligament? And I kind of have a spiel that I talk to all of my clients about. It was a 3-part spiel. You do one of 3 things. The first is you do nothing. And I don't like to say that. Obviously, I'm a PT. We know that within 4 weeks of total cruciate rupture, that osteoarthritis sets in. It's that quick. And that's surgical, where they actually went in and cut the cruciate ligament. So this was a research study. But even in a short time, we do see the presence of osteoarthritis in our cruciate dogs. So I don't like to say that. There's plenty of alternatives and, plenty of things that we can do these days for cruciate, especially bilateral. It becomes a point where some of these dogs are even non-ambulatory. They can't even get up if they have both knees that are ruptured. And it presents as neurologic disease. Well, actually, no, it's bilateral cruciates. So, one is do nothing, but we tell them all the bad things that can happen because of that. The second is surgery. I've worked in specialty hospitals, 2 specialty hospitals my whole career. I've worked with veterinary surgeons. It was an amazing relationship back and forth. Let's go talk to the surgeon about surgery. I can walk you through the physical therapy protocol. This is what it's going to take. That can be a whole nother topic. But, within 8-ish weeks, these dogs are 80 to 90% healed. Post TPLO was the primary surgery that I saw. I mean, I'm old enough to see the lateral suture, which is not done that often anymore. But of course, surgery costs a lot. So that's not always an option. It could be concomitant disease. It could be financial. So the third option is for sure in orthosis. And that's where I came in and working with the surgeon. Hey, go talk to Carrie. So it was a mutually, just an amazing relationship for what's best for that patient and that client. And so we send patients back and forth all the time, depending on, the client's choice. And I think it's important that you have that relationship with, the surgeons, and to talk freely about the pros and cons of all of that. So doing an orthotic device is not without its cons. Pros is that it's cheaper. It's certainly less expensive. Cons is that it's, as far as we know, it's for life. We don't have enough data to say that if you leave an orthosis on for 6 months, 9 months, 1 year, whatever that looks like, that knee is going to scar down over time and prevent, retard osteoarthritis. We just don't have that data. And I'm very, very upfront with my clients about that. The other thing is we think it reduces drawer. We don't have enough biomechanical data for that either. What we do see is function, and we see improved function. We see that dog now stand on its limb to go to the bathroom, to do their walks, to do their hikes here in Colorado. But for sure, you have to monitor it. I mentioned that sometimes the Velcro, especially in the furry dogs, can wear down over time, and perhaps it slips or it's not on tight enough. There's all kinds of problems that could happen. We talk about sores. So it's really important to train the owner of how to don and doff, meaning put on and take off that orthotic device, as well as monitor for potential problems and nip them in the bud before it happens.
How long would you expect a dog that has an unstable knee due to a cruciate tear to wear this orthosis per day? I mean, they're not in it 24/7.
Yeah, it's a great point. So what I train when we first get the orthosis back, I have the client come back to the clinic, and I put it on, I adjust it, I make sure that I'm comfortable with the fit and happy with that, and then I teach the owner how to put it on. And we talk about wearing schedules. So the dog will wear it for a half an hour, take it off, check for sores, maybe 2-3 times a day for a half an hour at most. And the next day we'll wear it for an hour, several times of the day. It gets the owner comfortable putting it on, taking it off, gets the dog comfortable wearing it. And over a 3, 4, sometimes 5-day period, we're continuing to double the amount of time that the patient is wearing the orthosis. So they'll wear it for an hour, we'll bump it to 2 to 4. Once they're in it for 4 hours and you don't see any concerns, they can wear it throughout the day. And we ask owners to take it off at night. And what I tell them is also to take it off if they end up, going out for a few hours. Take it off. It's an expensive chew toy, right? So if something were to happen while you're out of the house, what's the dog going to do if it hurts? They're going to try to chew it off. And that's a natural response. I can't fault them for that. So I do instruct the owners to take them off at night for sure. And then if they're away for an extended period of time.
So in the last show, we talked about, casting to have a custom device. What do you think about now they're coming out with 3D imaging, some of these orthotic companies that are making these orthoses? Is that a viable option? Like the casting is kind of the old, gold standard, but now there are newer techniques that are also worth pursuing.
I've looked into some of those in the technology. Let's remember, I'm an old school kind of girl. I've been casting for over 20 years. So it takes me no time to me, the technology, I could never really get it to work properly. And it took a lot more time, and we kind of abandoned one of the newer products out there for that reason. Plus, there were some other issues underlying that. I didn't feel like it was high enough temperature. It was the thermoplastic material. The plastic material is a little bit more flimsy, in my opinion. And I didn't like the design that they use biomechanically. So the design of those, I kind of abandoned a couple years ago because of all that. So for me, and honestly, I think that's one of the most intimidating points with bringing this service into your rehab facility could be the casting. People are afraid of it. Now, I've also seen some companies that you have to sedate the dog. You have to get them standing, and you have to wrap this around them and mark this and mark 25, maybe not 25, but you have to mark, 5, 10 different landmarks. I don't do that. I work, with Hero since early 2000s, and the casting process for me, I hardly ever sedate unless the animal is truly fractious. I think I've done 1, maybe 2 patients that had to be sedated. Otherwise, the client's in there with me, and I usually have the client, we lay the dog down, they pet the dog, and they comfort the animal. And I have another a technician or somebody helping me hold that stockinette. And I can do the casting within a 30-minute treatment period for physical therapy, which is what my normal PT appointments are anyway. So I think it can be intimidating, but if you know how to put a bandage, which I know all veterinary technicians, most of us can do bandaging. If you know how to bandage, you can cast.
How much room is there for the possibility of error in that casting? Is there any forgiveness in that casting process?
Well, if you cast and you take it off the dog and it falls apart, you're going to need to cast again.
That is no good. Yeah.
And that is no good. But
that's a failure.
That's not going to work. But if you lay the dog down and for the most part, as long as you don't catch the fur, these dogs are really tolerant, especially with their moms and dads by their side. They're super tolerant of it. It's surprising.
Yeah. And Carrie, are you laying the dog down so that their muscles aren't engaged when you're casting?
Yep.
Is that the reason for laying the dog down?
Yep. And I do not shave. You do not need to worry about shaving. That is, so you talk about forgiveness. People are worried that once the dog wears the orthotic device that they're going to build muscle, and now all of a sudden it's not going to fit. And that's not the case. Fur, golden retriever, not the case. It's not a problem at all. I wet the fur down so I don't catch it in the casting material. And the limb is in extension. So I have, my assistant help with maintaining a normal, pretty much 90-90 hip position, casting with that limb straight out. And that's the preferred for Hero braces.
About patients who have that like excessive skin, like the Shar-Pei, right? Is that problematic? Will you get your custom brace? Will that move with the skin? I'm just thinking about dogs that have like some of my patients, I get them like, maybe this isn't a candidate for an orthosis because of this like excessive skin roll. Yeah.
No, and I've never really had an issue with skin. What is potentially an issue for a stifle orthosis is length of the femur. So, you have the little bulldog who's got a little short, stubby thigh. That could be one potential. Some of the smaller dogs that just don't have enough to hold on to. But that's where I go back and talk to Ben and talk to Ashley and the staff there and say, hey, let's do some, some pictures. I just will send them a picture and they can evaluate it and help me with that, whether it, is that going to work or not.
And I think, Carrie, you've mentioned, right, that kits are provided for all of these braces. So
yes.
All the materials come that you need to be able to cast and then order the braces. And I think that some companies, as in any profession, are better than others in terms of follow-up and communication and willingness to problem solve and such. And I think that is very, very important when it comes to canine orthoses in general.
Yeah, that's an excellent point. So, the company, the Hero Braces that I work with, Ben is the owner. He's a CPO, and that stands for Certified Prosthetist and Orthotist. So he has done all of the additional training to understand the biomechanics. He's the one that designed all of these. And, so he has a good understanding of the biomechanics. And like you said, let's do some clinical reasoning, brainstorming, and they have a better understanding of what I might need for various pathologies. And, we've created over the years, we have dogs that, you've seen the cow hawking. Do you guys know, the cow hawks? Yeah. So, and I'm sure most of the audience may understand that. And they're what we call varus valgus. So valgus is the cow hawk, where the hawks are coming together, sort of on that medial
the feet are
aspect.
turned out.
The feet are turned out. Exactly. So we have done, some lifts to correct that. And, we see valgus, does that create stress on the knee over time? And can we correct that early on to avoid potential issues? You'll see external rotation at the hip. Does that cause dysplasia down the road? So all of these things we still need a better understanding of, but that's the understanding of a CPO, and that's why I work with them.
Back to the kits and Kathy's question about, what if you mess up? Do you get do-overs? And we've talked about that. Like, there's enough material that if you aren't happy with the result of your cast, you can do it over, correct?
Yes. Thank you for putting me back on track. I go down rabbit holes. But yes, you absolutely. So that kit that's supplied by Hero comes with multiple casting, and it's it can be a little bit tricky to work with at first, because if you wait too long, it'll dry out on you. You have several minutes before that cast material hardens. So you kind of have to work fast, but once you get it down again, you're going to be golden. And it comes with extra cast material. So yes, if my cast falls apart, if I miss a spot while I'm wrapping, that we have little tricks of the trade. You overlap by 50%. I start at the bottom. Hang on to your stockinette. There's all kinds of tricks of the trade that will help you improve with your casting technique. And I've done it on many occasions. For whatever reason, it's a bad casting material and it falls apart, or I did a bad job and I missed a section on the underside of the limb that I didn't see, and I'll just start over and do it again. It's not a problem.
And I think with all of these, like you've implied, practice makes perfect, but maybe on the front end, if it is your first cast, cast your own dog or, a fellow employee's dog to just get some practice and realize, the little things, the details that may make a difference that aren't so obvious. I have a question kind of following up on what you said before. So, you said the dog is lying, down on their side in lateral recumbency, and the actual limb, the knee itself, I guess, is in full extension.
Correct.
Which is not straight for the pet owners out there. It always stays bent a little bit, but not necessarily the weight bearing position then. Full extension, you're casting it.
Full extension, I am casting. That's correct. And I start just under the hock. I don't need the hock, but the brace comes down to the just the top portion of the ankle itself. So I start just below the hock and work my way up into the thigh, into the groin, as high as you can go. And then with that stifle and extension, they just need an endpoint when they fabricate the orthosis itself.
With you starting, as low down toward the ankle as possible, and then going all the way up into the groin as high as possible, you're ensuring that you have enough cast in terms of length, and then the orthotist can go from there.
That's correct. Yep. And all I do is, once it's dried, then I cut it off, ship it out to the CPO, and he fabricates and ships it back.
But, we were talking about no need for shaving, that you wet the dog down. What if it's a dog that requires grooming and, they go on a regular basis, and they can be really fluffy or they can be shaved down, periodically? Is there a better time to do the cast based on their grooming schedule?
Nope. Never crosses my mind on the fur. And if you think, I've actually had some dogs that were shaved from surgery, and some dogs will come to me that had a meniscal tear. We should probably talk a little bit about that as well with bracing. There's a lot of discussion out there that a dog with a cruciate rupture that has meniscal tear should not be in an orthosis. And I can tell you, we've had some that have tolerated it and some that have not. And what we need to understand is why. Is it, wouldn't that be neat to stick a scope in there and understand the severity? Is it severity of the meniscal tear? Is it location? Is it bucket handle versus not versus, there's a lot that we still need to understand as to why. So often the surgeon will go in, release that meniscus, and the dog's shaved for that surgery, and then I'll go in, even while the dog's being extubated and waking up from anesthesia, I'll go in and cast the animal and not worry about that fur growing back at all.
So are you saying that the dog is not undergoing a stifle stabilization surgery, but a quote lesser surgery to release the meniscus,
and then we brace it,
and then bracing?
Correct.
And I know that, one of the things that I've heard is if you leave a cruciate tear unstabilized, if you will, that yes, that leads to meniscal tears. Let's say they don't have the meniscus tear and they wear the brace. Do we have any research that shows that it reduces the chance of meniscus tears down the road?
Great question. Nope, sure don't. Yeah, and why do even some of them with post TPLO end up rupturing their meniscus or tearing their meniscus, I should say? So why do some dogs that are, 4-6-ish weeks out of TPLO surgery now come back non-weight bearing, and now it's meniscal tear? We don't really understand that either. So put that on the research list, okay, ladies?
We'll get to that in our spare time. Yes,
we got a lot to do.
We do.
There's so
we
much
sure
to do.
Carrie,
can I go back or circle back to something you said about the bracing of the knee? Did you say that I know you said you would cast below the tarsus, and I see some dogs that have braces that will include the tarsus, and they've had CCL tearing or cranial cruciate ligament tearing, and I suspect that maybe that part of the cast extends over the tarsus because the dog might have some tarsal torsion. But do you include that in that every time, just in case you need to have that stability at the tarsus as well as the stifle? Okay. I've seen some braces that go all the way down, right, over the hock. And some that don't.
Yeah, it's a great point. And my question is why? Right. What is the stabilization? And can you reduce that torque? Can you reduce that with just an orthosis alone? And I would question that. I never include the tarsus in a stifle brace because you need that 3.4 system to supposedly, reduce drawer. Like I mentioned, we think just biomechanically, pure biomechanics, if you have a 3.4 system, it's going to offset that drawer. So now if you're trying to stabilize a 2-joint system with a 3-joint or a 3.4 system, it makes no sense.
You mentioned earlier, maybe touching on meniscal injuries and the patellar luxations before we move on to the tarsus.
Yeah. So I mentioned earlier, we see a lot of those human knee braces in people that have patellar issues. You think about the stance of a dog versus the stance of a human. We are vertical, and when we stand, our knee is at 0 degrees. In a dog normal standing angulation is about 135 degrees. So there is nothing out there on the market that is going to mechanically stabilize a patella that's luxating, especially the higher grades, the grade 3, the grade 4. It bunches in the back. There's no way to maintain that stability at that angulation. And so don't let anybody try to tell you otherwise. It's just not available out there. It's not going to work.
And for the non-medical people out there, the patella is the kneecap, and it is so tiny in a dog.
So tiny.
So, Carrie, why don't we move on to the tarsal joint and tarsal orthosis? Let's talk a little bit about the Achilles tendon injury, because I think that's a fairly common thing that we see that happens in the tarsus.
Yeah, yeah. And it's interesting. So the more I travel around and talk about this, the more I'm realizing this is primarily an America problem. And I was just down in Brazil a couple of months ago, and they're like, no, we really don't see that injury. Even in Europe, no, we really don't see that injury very often. But because it's a tendon, these require a long time to heal. And I don't know if anybody's ever ruptured their Achilles as a human, but you have progressive weight bearing. Tendons are notoriously difficult to heal because of the poor blood supply, same as in animals. And if you think about it, it's even more important because the dogs stand on their toes, they're digitigrade. So I've had several cases that have had surgery. One thing led to the other. Who knows? Did the dog do too much? It just didn't hold, whatever the case may be, but it's broken down multiple times, not just once. And finally, we're like, we're done with surgery. Let's put this dog in an orthosis. And we have been more recently, in the last 5 years, we're hoping to get this published. We're working on this now if we can ever finish it. But we have a graduated flexion orthosis and doing PRP injections with a graduated flexion orthosis. And it's been really good results thus far. We still need to understand long-term better, especially in some of our sporting breeds, but we have a dog that runs with its owner and 2 hunting dogs that we have done this technique on together with the surgeon, as well as an anesthesiologist that does musculoskeletal ultrasound. So between the 3 of us, we're sedating the dog. Dr. Wright comes in and she'll do the ultrasound confirming. It's primarily on what we call type 2C lesion in the Achilles. So the toes are still curled. That superficial digital flexor is still intact. She uses ultrasound guided injection into the lesion itself of the dog's PRP. And I am casting the dog prior and fitting it with a graduated flexion orthosis. And if you think about tendon healing, the key to tendon healing is what? Load management, right? Mm-hmm. So we've got to find a way to allow the animal to weight bear when historically these dogs would be put in a bivalve cast and not allowed to weight bear at all. For the most part, they were 3-legged lame. Well, it's not going to provide that stress to lay down those tissues and realign those tissues to strengthen as best we can. And that's key to tendon healing.
I'm thinking too, like my patients who've had Achilles tendon tears, I mean, that tendon will never have the same strength that it had, even with surgical repair, the same strength and structure it had before injury. So I think orthosis is really key here for these patients.
Absolutely. And that's a good point. Regardless, it's never going to be 100%, right? But our goal is to get it back to as close to 100% strength as we possibly can. And that's the beauty of this. So the idea of a GFO, or graduated flexion orthosis, is that we unload the tendon. We can put that in a little bit more extension, unload it, and over time, we gradually increase the degree of flexion to allow for more weight bearing, more stress, to realign those collagen fibers.
As we wrap up here, are there some final messages that you would like to, share for our listeners?
There's probably several, myths about an orthosis. One of the biggest is, if I put an orthosis on a dog, that limb's going to atrophy. So they think that it's going to take the place of the use of that limb. And that's one of the biggest myths of that. If anything, the definition itself is to support an injured limb. It's to build that muscle again and to use that limb in a more normal fashion. The other is, the intimidation, I think, with the casting. And, as I mentioned earlier, it's once you get into your rhythm and you do a couple of practices and you know how to bandage, you can whip a cast into place, no problem. So those are probably the biggest ones. And then, if we're seeing mistakes, it's because that we're not managing the dog enough. We've got to be able to have longer term follow-up. We've got to be able to document it and understand it. Don't just put an orthosis on your patient and out the door they go and you never see them again. And certainly that happens, right? But it's important to do the follow-up. It's important to monitor these cases so we can avoid breakdown over time. The one mistake I'd love to see clinicians stop making is the fact that they're not using orthotics. I think it's a very underutilized because it's somewhat intimidating until you understand it and until you dive into it.
My final question, Carrie, how do we monitor success ultimately? What signs tell you if a brace is helping or not?
The biggest thing that we look at as physical therapists is by far function. The force plates, the kinematics, the EMG, that's all good and well. But what I want to see is that dog is able to now get up off the ground, able to go outside independently, to go to the bathroom, able to take, a walk or a hike with their owners. That's what matters most. Making them more functional is key.
We're putting the fun in function. That's what we're doing. It's what we're doing.
I love it.
Carrie, thanks for joining us for part 2 of this discussion. Again, I've just learned so much. And again, that's what it's all about. The collaboration, the learning, the teaching each other and learning from each other. You've helped us to understand not only what, orthoses do, but why proper design, fit, and rehabilitation are so crucial to the successful outcome, right? And that's what we want. We want successful outcomes. So as we're closing, can you let our listeners know where they can learn more about your work and where they can find you?
Sure. Yeah, my website is canineIQ.net, CANINEIQ.net. And that's the educational platform. You're always welcome to email me at info@canineIQ.net.
Thank you, Carrie. Thank you. I hope that we can have you back again. We'll pick another topic and you can come back again. So much fun talking to you.
Let's just prepare for a 3-part series in advance.
Yeah, next time.
That sounds great. Listeners, let us know what you want to learn and what you want to talk about.
There you go. Thanks
really
much.
Appreciate it. Thank you.
Thank you, Carrie. Bye.
Thank you for joining us. We hope you enjoyed our show.
Follow us on social media at Petability Podcast.
And please check out our affiliates and sponsors.
Simply go to the show notes for information and links.
Thank you and tune in next time.